So I'm making a video for the rehab workout to fix your knees. Yep. So the first thing you just need to get, it's like a loop resistance band, and they come in different like strength levels. Like the red one is the weak one, or the easy one, and like there's a middle one that's a green, and the purple one is like the hard one. So they're like $10 or $15 on Amazon, eBay. They're called loop resistance bands. So the first exercise, you're just gonna lie down on your stomach, and first you wanna take your bad knee, the leg that has a bad knee. You just put your heel and ankle inside the loop, and you just lay down, and you attach it to something like a leg of a bed or a couch or something that doesn't move. And what you're doing is you're just laying flat, and you're just doing like a what's called a butt kick, or you're pretty much just raising the, yeah, so it's pretty much like doing a butt kick, but you're laying down on your stomach, and you do that 10 to 20 reps like that. You just raise your foot off the floor, going towards your butt. They're called butt kicks. Then, after that, you could use the same band, but I'm using like a more advanced one. You're gonna put your foot in the resistance band, and you're going to just pull towards your body. You're gonna pull the band. Make sure your leg fully extends, fully like that, straight. Make sure it fully extends, and then you just bring it towards yourself as much as possible. And the resistance is gonna hold it's gonna kind of resist it, right? So yeah, so do that also 10 to 20 reps. Maybe start with 10, and then just when it gets too easy in a few weeks, you could progress and do like 15. So the more reps you do, the more blood flow you're gonna pump into your knee, and once more blood goes in there every day, is going to create more cartilage, and it's gonna actually supply the nutrients and like the vitamins and minerals that you need to regrow cartilage back. But to get those nutrients in your knee, you need blood flow, like a constant blood flow every day. So if you pump the blood flow into your knee every day, in a few weeks, your cartilage will start, not even in a few weeks, like right after the workout, you're going to feel immediate relief, because the blood will go in there and it's going to start healing all the cracks that arthritis created, all the damage that's been there. It's going to start healing it and disperse of inflammation and fluid. And that's so these exercises were made by this doctor who actually healed his knees and back. He had a broken back, he had all kinds of injuries. He's a professor that used to work as a chiropractor, and physical therapist. So the next exercise you're gonna do it's almost the same. You're gonna put your foot into a loop, and you're gonna lie down on your back. And now what you're doing is you're just pulling it towards yourself. So it's almost the same, but instead of lying on your stomach, you're instead of being like on your knees and hands like facing down, you're gonna be laying on your back and just pulling it towards yourself, pulling towards you, like your knee towards your face, pretty much. Right. So then the next one will be it's the same thing almost. But now you're gonna lay on your side. You're gonna lay on your side and do the same thing, but make sure your knee fully extends. After you pull it towards yourself, make sure your knee fully extends. Like it fully extends, and bring it towards yourself like that, and do it 10 times. So this band is kind of difficult, so I can't do it a lot of times because this is like a very difficult band. It's very thick. I started out with this with this skinny one, so it was very easy. But then I progressed, and now this one is too easy, but this is still a little bit too difficult. So all right, so we did all that. Then the next one will be, again, you put your foot into the loop and you kind of sit like an angle. So what you have to do is you have to pull away like that, pull away from the post of the bed or wherever the band is attached. Like, so you have to push, it's called adduction. So you're going with your hip, you're pulling towards, like, to the right. So you're pulling towards your body like that. Yeah. So you're pulling towards your body, away from the post. Right? The next one, you're doing the opposite. You're pulling to the left now. So you do it to the right. Now it's pulling. Now you're pulling away, like away from your body. So your hip is pulling away, away from your body, right? And obviously, if you have two bad knees, you do same thing. So, same thing. Then if I had bad knee on my right leg, then I would do everything the same. I would pull away to the right, like away from my body, like that, and then I would pull like towards my body. So you're just changing legs. You're just rotating different legs, but everything stays the same. Like that. So after that, try to remember, there's like 11 of them. There's loops. Okay, so now I'm gonna get now you need like a resistance band. So resistance band. So we're finished with the loop. So you also need just a regular resistance band. The one that has like some resistance to it, like maybe like 30 pounds or 35 pounds. You're gonna lie down on the floor or the mat, and you're gonna wrap it. You're gonna put your foot right in the middle of the resistance bands. You're gonna hold it with your hands like that by both sides, so you keep some resistance. And you're just gonna lay there, lay flat. Actually, let me put your position this mat. So you're going to lay flat, and you're holding resistance with your hands, right? So what you're doing is you're just doing a leg raise, but you're doing a leg raise while the band is like it's on your foot pretty much, and you do like, again, 10 to 12. I recommend doing like 15 of those. So it's just a leg raise, but you're constantly keeping resistance on your leg, which provides resistance to your knee, and you're pumping the knee, you're pumping the blood and circulation into that knee to regrow the cartilage back and supply nutrients and vitamins. And then the same thing the other leg. Like some people have both knees that are bad. Like I have both that are bad. My left one is worse than the right one. So I gotta do both legs, but I usually do the left one because the left one usually hurts and the right one is okay, but you could do both. So the next one is almost the same. So again, you're holding that resistance, but you're just laying on your side, right? You're laying on your side and you're holding the resistance, and you just do a leg raise, but you're just laying on your side. That's it. That's the only difference. You're laying on your side. Very simple. All of these are very simple. Like you don't have to have strength or anything. Just have one resistance band and those loop resistance bands. Yeah. So that one. Okay. So there was one on your back, one on the side. Oh, okay. So there's another one. So this one, you're gonna raise your legs straight in the air like that, with holding resistance. And then you're just gonna do. This is a butt kick. Yeah, it's a butt kick, but you're just holding your foot. You start from your leg being like that in the raised position, and you just bend your knee. So it's kind of like a butt kick, but you're laying on your back and you're holding resistance with the resistance band, and you're doing a butt kick, where you're laying down. Usually butt kicks, I'm not sure if you ever seen like the sprinters and like the track people and basketball people. They do, maybe even football players. They do butt kicks when they're running. So this is almost the same, but you're just laying on your back, and then you switch to the other leg. So it's the same. Yeah, it's the same. Yeah. So then the next one, it's just you're holding again resistance. You're doing like a kick out, like that. You're doing a kick out. You're holding resistance, and you're trying to like kick out, like that, kick out, like that. Yeah. And almost coming to an end. There's only 2 exercises left. So this one, you're just gonna put your resistance band in the middle of your foot, so it doesn't come off, and you kind of just hold it like that by your backside, like that. And so this one is also like a butt kick. So you have resistance, and you're just pulling it down like that, like that. You're just raising it like that, like a butt kick, and you're resisting it from the top because you're holding it, right? You're holding it like on your back with both hands, and you're just kicking it down like that. Just bringing it down. Sometimes resistance band will come off, so you have to kind of readjust. So if you have a partner, so every point where the resistance band is attached, that could be your partner holding it for you. So if you have no one, most of the time I'm working out by myself. But if you have a partner, you actually don't need these loops, because your partner could just hold this for you, and you just go through the motions the same way. But so imagine like this leg of this bed is your partner's hands holding the band, just holding the band, but everything's the same. So if you have someone to help you or a partner, then you can just have them hold the resistance band, and you just wrap this around your foot, like the band, right? But most of the time, if my wife is at home or whatever, I don't have anyone to hold it for me. So then I have to attach it, and I don't have to bother anybody, So there's another one. The last exercise is you're just gonna put your foot in the sloop, or have someone hold it. Have someone hold the band from like next to the floor, like this. You're gonna wrap it around like the person's foot, and you're gonna hold it on the floor, and the person will be raising their foot like that off the floor. So you go to a completely straight leg like that, to just raising it to about like 90 degrees like that. There, like this. So imagine someone's holding the band right there next to the floor, or you could just attach it to something. And that's it. That's the whole knee rehab. So right away you should feel immediate relief. Like if you have pain in your knees, like aches and pains, like that will go away for maybe like 24 hours. Because the blood flow will be circulating for 24 hours, and after 24 hours, it's going to start diminish. And then you got to do it again. And then, so if you do this rehab every day for your knee, like your bad knee, then you eventually in like a week or a few days, you're not going to have pain anymore. Actually, it's going to work right away. You just have to keep doing it every day, because like I said, the blood flow just circulates to your knees, and then you're not going to have pain or aches. But as soon as you miss the rehab like 2-3 days, there's no more blood flow, and you're going to start feeling those aches. The aches and pains will start coming back. So, well, thank you for watching. I appreciate it.